In October 2011, Leanna Storm and David Lee met in Vancouver to reflect on being peer research associates with the cross-Canada study Alcohol Use by Aboriginal Persons Living with HIV and AIDS and its association with access to care and treatment. They also talked about the results and how the study connects to their personal experience.
It actually became reality and said, okay, we're going to do it. Oh, great. And I've been involved ever since. And it's been cool. It's
been pretty fun, hasn't it?
It's been lots of fun. It's been quite the learning curve for some of it. And it's just, some of it is, wow, it's overloaded sometimes, but not too bad for, well, doing university work.
Yeah, really?
University work on a grade 9 education. Well, from them, I learned how to, about the technical details about how the ethics involved. But I didn't realize for surveys.
Really extensive.
Yeah, I didn't realize it went to the lengths we'd go to do a survey and get results. And I didn't realize how much work was involved until I started talking to the researchers and learning from them how it's done. It's a lot of work. It's very tedious and time-consuming.
The people on the team were just amazing, though.
Yeah, yeah.
Wow.
Their patience and willingness to teach us, because it's. I come from the street. I don't come from the academic world.
Yeah, same here.
Okay. We've brought a face and experience from the street, and our experience of HIV and AIDS to people. Researchers who don't have the knowledge and experience that we have. Yeah. We got the street smarts and survival skills that they'll never have, and they got the learning and book stuff that we don't have, and we're like, like you said, we're the bridge.
We're bridging the gap
between the two worlds.
Yeah,
is what we've done, we are doing, and it's pretty exciting to be part of that. Actually,
it is.
Actually, for me, what I got involved, I knew how bad we were treated. I knew we weren't getting the treatment. Some of us weren't getting it. But to see the numbers now for what they are, it is pretty sad. Yeah. And it's showing the reality of our world, and here it is in black and white. And it's more than I expected.
Because I do outreach, and when I do outreach and I'm in the hospital, it's like, for me, it's like, it empowers me, because I think, okay, you know what? I've been positive this long. I've done this long. You can do it too, and it empowers. I feel very. It can be challenging, but at the same time, you can
be rewarding.
Rewarding,
very rewarding, and in a very personal way. It's really hard to define it.
The purpose of the study was to determine the association between actual or perceived alcohol use and access to services from the perspectives of both Aboriginal persons living with HIV and AIDS and service providers. We used a mixed methodology approach with surveys and follow-up interviews. Data was gathered from across Canada. A total of 116 Aboriginal people living with HIV and AIDS and 109 service providers participated in the survey. Then, 25 Aboriginal people living with HIV and AIDS and 23 service providers who filled out the survey were also interviewed. The clear conclusion that our research team came to from our review of hundreds of numbers from our surveys and thousands of words we heard in interviews, is that Aboriginal persons living with HIV and AIDS in Canada are being denied care because they drank alcohol, when in fact they did not. This occurring, and to even one person, is far too many.
The research project found that access to services lowers when an Aboriginal person living with HIV and AIDS is using alcohol or is perceived to be using alcohol.
It's a very hard process to even reach out and go ask for help, and when you go ask for help, you get turned away and you're shot down. Like, it took a lot of courage to get to
where you're at.
to get to where you're at, to go ask for help. Like, that's a big step in itself for us. Like, we're taught do yourself, do everything by yourself, don't count on nobody, and that's it. And the one chance we go take an opportunity to go ask for it, we take that chance to go ask for help when we get shot down. Of course we're not going to fucking take that chance again, and after being treated like that. Would you? I know I wouldn't. I don't.
On being denied services, one of the Aboriginal people with HIV and AIDS interviewed said, "I've called out for help a lot of times when I was really bad into it. And they were just like, come back when you're sober. And when you really need help, I think, I just found the door wasn't readily available for me to come through."
If you've been doing dope a lot in your life and you quit or whatever, it does attack the central nervous system, and people think right away, okay, this person has not done drugs in so long and whatever, but yet they still act that kind of like that drunk.
Yeah, they come in, they're hungover, are still drunk from the night before. They're not, they're still drunk, but it's not because they're drinking this morning, because they're drinking last night. And they're still drunk, and because of that, they're trying to comply, because they're there to take the drugs, but they're not in shape, but they're trying to do the best under the situation.
That when people are taking their meds, and just maybe I don't know. But I've seen that where somebody comes in and they act like they're all drunk and kind of like diabetic or whatever, and they haven't been drinking. But I've seen people being so rude to them because they thought that they were drinking.
Other misperceptions of drunkenness came from assumptions based on information, such as unusual blood work, a history of past drinking, and aboriginality and HIV status. Smell, including fruity smelling breath, which is often associated with diabetes or malnourishment, the smell of a hangover, and the smell of poor hygiene. Behavior, including drowsiness and raggedness from missing a night of sleep, side effects from a variety of medications and illnesses.
I've seen people, like when I do my hospital visits, I've seen people being treated like, being treated like shit because they're positive and they're addicts and being Aboriginal, like.
Yeah, it's not.
And I've heard nurses in the backs, he's got this and this. It's sad, but true.
Yeah, it's hard to see that, and it's when I see stuff like that is when I hear and I realize, yeah, I know why I don't get treatment. I know why I don't go to the doctors. I don't go to the clinics because of that treatment, the way I get treated. And yeah, it's like it's not a good feeling at all. If I'm not going to die, I'm not going to go. As simple as that. Even then, I'm not even sure if I want to go, if I'm going to die, because do I want to get treated like that in my last few moments, and like the way I get treated in the hospital? And I'm thinking, no, I don't want to. And it's just, so I just to a point of no, I refuse to go in because of the way I get treated.
Reflecting on the research, David and Leanna found ways to connect their research back to Aboriginal communities.
When it first opened up, I didn't come here for the longest time. I didn't want to come look at this, deal with this, look at that part of it. I'm thinking of that, but that's not the problem it was before. And I come and I see the people who've been here and people who encouraged me when I first came here.
Yeah, amazingly, we do know some people on the wall that have
more than I realize, more than I want to, and more than there should be. But hey, it's one of the reasons why we do this work, right?
Yes. Yes, exactly.
Don't want to see my name up here, but it probably will be one day.
Same here.
For a while, yeah.
Not for a long while.
To be a bit more open-minded and sympathetic towards the people who they're dealing with.
A little bit more compassionate.
Yeah. It's a paycheck. It's not a job. It turns in for some of them service providers they become jaded, and after a while their job is it's just a paycheck. It's not about the people anymore, and Yeah, not painting them all that brush, but there's the few that give all of them a bad name. Same with how they lump all us PHAs is all we're all bad, wanting, needing dope fiends who are going to rip you off first chance we get. But we're not like that, and not all of them are like that either. So what we're dealing with is a lot more complex than what the average person does deal with. There's a lot of things we've got to learn about with this disease, about health and numbers and what they all mean. Like, that's a steep learning curve in itself in the beginning for some people, and some people they don't understand that, and it's got to be explained to them. They don't until those steps are taken. Yeah, there is going to be. It is what it is right now. I've gotten out of it, and look what I've gotten. I moved home after 40 years, and life's great now. I'm very happy with what's going on in my life. But it's by taking some chances and doing some things I've never done before. And that's what part of this research has done too, is taking a chance and being part of it. I'd never done it before. I didn't think I had anything to contribute and be part of this, but it turns out I'm a big part of it.
We have a lot to say, yeah.
We have a lot to say and a lot to do and a lot to we have done a lot, we've said a lot so far.
Someone asked me the other day, it was quite interesting, do you own this illness or does it own you? I said, huh? What do you mean by that? And I thought, it's true. The illness doesn't own me, I own the illness. I'm going to control the illness. I'm going to take my meds every day, get rest, and do, live
a healthy life,
yeah.
Live a good life. Yeah. I'm not going to do what I used to do before. To me, that's what it is. And what I used to do before was drinking and using people.
Yeah.
And not living a good way. And it's just, it wasn't rewarding that I get out of life now, because this is rewarding, and it's very rewarding, the work. It's not just for me. I'm working for a lot of other people. It's who it's for.